Relatives wait outside a busy emergency department in Sindh province. Their children are inside, isolated, receiving treatment for COVID-19. At least 930 children under the age of 10 have tested positive for the virus. Most of them are symptomatic, but the concern is how they became infected in the first place.
These are all local cases where the children probably have gotten this infection from some of their elders who had left the house, who had gone somewhere, or probably the family did not practice social distancing in a proper manner. The reason why I'm saying this is because since the 26th of February 2020, schools have been closed.
Despite the Pakistani government's advice to follow World Health Organization guidelines on social distancing, many people here are not. For some, it's not a choice. Most of the children that tested positive come from poor communities. They live in cramped conditions, big families, in small spaces.
Look at the situation we're living in. It's all solid waste. The smell is everywhere. Meanwhile, the government is talking about hygiene and social distancing. How is that possible in a situation like this? And how can we keep our children safe?
Many of Pakistan's hospitals are struggling to cope with the number of COVID-19 cases. More than 61,000 people so far and more than 1,200 deaths. With the economy already weak, the crisis has forced many people out of work. The government projects 18 million job losses. More Pakistanis are relying on food handouts.
It's a catch-22 situation where, if you open businesses, you put everybody's lives into risk. If you shut down businesses, then there is an economic downturn. So it's not an easy choice. It's the choice between the devil and the deep sea, basically.
Pakistan is considering imposing another nationwide lockdown in hope of flattening the curve. But it may prove hard to follow for those living in Sindh province, which now has the highest number of confirmed coronavirus cases in the country. Sarah Khairat, Al Jazeera.